Good morning. We'll begin our webinar in about a minute, so please hold on. Thank you for joining us. Good morning. I'm Elaine Boyd. I'm the Executive Director for the New England section of AWWA, and I'm happy that you're here joining us today for this great webinar on addressing Legionella in water distribution systems and customer buildings. And right now I'm going to turn the time over to Carly Sampson, who is on our board and is the chair of the Water Quality Committee. So Carly, why don't you take it away?
Thank you, Elaine, and thank you all for joining us for this webinar. I'm going to start with a few introductions, and then I'll get into introducing our speakers. So first of all, I wanted to mention the 2025 Annual Section Conference. This is titled Wave of the Future, Innovations in Water Technology and Sustainability. And this is the New England section AWWA that will be hosting. We're excited to announce our inaugural annual conference, which is set for October 2025 at the Encore Boston Harbor. This event will bring together industry leaders, professionals, and emerging talent to explore cutting-edge innovations in water technology and sustainability. We invite abstract submission for presentations showcasing real-world projects, forward-thinking solutions, and practical insights that will help shape the future of the water industry. Submit an abstract at www.ne-awwa.org/annual_conference. The link is here on the slide as well. And we invite you to become a valued sponsor, exhibitor, and or a career fair supporter at our annual conference on October 29th and the 30th. Registration is open now, so please visit the link that is on this slide. Also, at the end of the webinar today, we will have a drawing for a copy of the M7 manual, which is for problem organisms in water identification and treatment. This AWWA operations manual describes non-pathogenic organisms in source water, the various problems they can cause in water treatment, and treatment strategies. You must be present to win this manual. Also, we'll have a modern Mile High mix at the upcoming ACE conference. Elevate your brand, make a Mile High impact at the 48th Annual Joint Section Luncheon with the Connecticut section at ACE 25. Registration is open for sponsors. The link here to register as a sponsor is www.ne-awwa.org. The luncheon registration is coming soon. This will be held on June 9th, 2025, from noon till 2 p.m., and it will be at Earl's Kitchen and Bar in Denver, and it's just across the street from the convention center where the conference will be held. All right, and that's all that I have for announcements, so I will now introduce our speakers for today's webinar. Our first speaker will be Chad Seidel. Dr. Seidel is the president of Corona Environmental Consulting and a research affiliate at the University of Colorado Boulder. He focuses on improving public health protection by solving water-related engineering, science, and policy challenges. His nearly 25 years of consulting experience in the drinking water community has focused on water treatment, including microbial pathogens and disinfection byproduct minimization, groundwater and inorganic contaminant treatment, corrosion control, and regulatory and policy research. Our second speaker will be Christian Matthews, and Christian Matthews is a drinking water process engineer at Corona Environmental Consulting with 8 years of experience in Legionella testing and drinking water microbiology research. Christian is passionate about drinking water microbiology research and has developed Legionella monitoring and mitigation plans for multiple building owners and utilities across the U.S. All right, and with that, I am going to turn over the slides to Chad to start with the first presentation.
Thanks, Carly. Great to get connected with you all. Let me put these on screen, make sure everybody can see those. Hopefully that works well. Glad to talk about Legionella concerns, and particularly the Legionella concerns that impacted Grand Rapids, Minnesota, not Michigan. I actually had to look it up on a map when I first got the phone call asking if we could be of assistance to address Legionella concerns in Grand Rapids, not knowing that there was a Grand Rapids, Minnesota, an undisinfected groundwater supply. And so I'm going to step through the big picture overview. Christian's going to give much more detail with respect to some of the testing and aspects associated with that. But I always like to start with acknowledgements rather than wait till the end, because it really was a significant collaborative effort to address the Legionnaire's disease outbreak that was identified starting just a couple of years ago. So obviously the water utility, Grand Rapids Public Utilities, their great staff of management, engineering and operations and administration, both Christian, myself, and then our good colleague Jake Causey at Corona, considerably involved. Great other technical experts, including Dr. Mark Le Chevalier and Sheldon Masters from here locally in Colorado. We had terrific support from our good friends and colleagues at Confluence Engineering Group, Alex Mafidi and Linda Friedman in particular. The design engineer locally that was involved and still is implementing a number of things is Bolton and Menk. And then other collaborators, the University of Minnesota had some support via a US EPA funded grant. Clearly, the Minnesota Department of Health Drinking Water Program was involved, and both US EPA and Centers for Disease Control. So I like to start with the simple question: what issue should be our highest priority in drinking water? And if you think about the headlines today, I don't know how you can throw things in the chat, or you can maybe give a thumb raise when you get a chance to address some of these things. Just put in your thoughts about what might be the key priority. If you think about how the broader, customer base for our communities think about this, they might think about, well, what might just be in the headlines the most. And so, sometimes, especially these days, particularly yesterday with the news of EPA's announcement, man, PFAS sure is getting a lot of time and attention. Even if you just look at our programs for conferences, the number of talks on the PFAS subject alone is pretty substantial. Shortly after that, if not greater than that, especially in the Northeast section region, is the concerns about lead. But there's other contaminants too. Manganese is being talked about. Aging infrastructure sometimes gets some headlines and some attention. Affordability absolutely gets touched on. But a lot of times in our community, we don't talk much about Legionella, let alone Legionella pneumophila, which, Patsy, it's awesome to see that you're on the call and help jump that one right to the top of the list, because I tend to think while this might be the order in which headlines or conference time is being associated with things, I would reshuffle the priorities this way. I'd put Legionella at the top. I'm going to tell you why in a second, followed by other things like aging infrastructure and affordability that are increasing the concerns and the risks associated with Legionella and other microbiological pathogenic outcomes that are legitimately associated with killing individuals in our communities. After that, I'd put things that have other health effects like lead and manganese, but my personal professional opinion is that PFAS is pretty low on the list, given the pressing public health priorities we have in a number of other ways. So let me talk about why. So Legionnaire's disease, named after the unfortunate outcome of a number of Legionnaires, American Legion folks at a conference in Philadelphia, almost 50 years ago, about as long ago as I was born, contracted this bacterial pneumonia, lung infection spread by water droplets in the air that contain Legionella pneumophila bacteria. It's those droplets, when inhaled, can cause that infection in the lungs. You don't get sick if you drink it. You don't spread it if you have it. And it can take a while, a couple days to a couple of weeks after symptoms are exposed to have those present themselves. So if you look on the graph on the right that CDC publishes, and the most recent version still on their website just goes up to 2021, the incident rate of cases of Legionnaire's disease in the United States has risen considerably since 2000 and peaked right before COVID, took a break during COVID, mostly because of reporting and the changes in way that we were looking for and watching for these things. It will be fascinating to see the more recent data reported. Hopefully CDC will continue to be able to do that. But the other way to look at this is, where is this a problem? So here's the map. That happens to be the version of the map from CDC in 2018 about those incidence rates. And so while you note that the top of that chart in 2021 was in the 3 cases incident rate range, you'll note that the area of the section is the highest incident rates in the country. And it's been that way for quite some time. These thresholds change a little bit from year to year, but by and large, Legionnaire's disease is more of a Northeast problem than it is elsewhere. It's not to say Legionella may not be, but it is a concern. So we're going to focus in on Minnesota. You can take a look at Minnesota. It's not the highest, but certainly not the lowest, and want to talk a little bit more about what Legionnaire's disease means. I didn't have it in the slide, but others have looked at the incident rate of Legionnaire's disease in a number of other countries, and the U.S. isn't alone. Many other countries that have similar and frankly different disinfection practices are also experiencing increases in the incident rate of Legionnaire's disease. Some attribute that to better monitoring and reporting in the healthcare community. But I think we can't deny the fact that there may be things that we're changing, or that our environment is changing, that's leading to a rise in exposure and then poor public health outcomes because of that. So the common sources of infection, shower heads and sink faucets, cooling towers, decorative fountains and hot tubs, all of those things are usually implicated first. Drinking water systems aren't generally the place where this is looked for. It's generally past the meter in your customers' facilities, whether it is office buildings or hospitals or commercial facilities or industrial. But it's really not until it gets into those places that Legionella can become a substantial concern. So brings us to Grand Rapids, Minnesota. And in July of 2023, the state of Minnesota Department of Public Health epidemiology group responsible for Legionnaire's disease outcomes, not related to drinking water, simply said there was a rise in cases in Grand Rapids, where Grand Rapids had had 1 or 2 cases reported every few years, going back to almost a decade before. But then in 2023, by July, there'd been 5 cases. Fast forward, a little bit of context. In 2023, in total, Minnesota had 154 reported cases, including 6 deaths related to Legionnaire's disease. So that is kind of the timeline we're showing here. We had up to 5 total reported cases by July of 2023. And that's when the state issued this disease investigation press release saying that people with symptoms talk to their healthcare providers. They asked healthcare providers to be more intentional in looking for symptoms related to Legionnaire's disease. The state went and identified and sampled cooling towers in the community. They did find one cooling tower that was positive for what we say LP1 or Legionella pneumophila serogroup 1, which is the one that's predominantly associated with causing Legionnaire's disease. But they didn't tie it directly with some genomic sampling to the cases. They also maintained that the entity that had ownership and operation of the cooling tower had remediated the problem. I will say we never saw that substantiated. So in my mind, it still could have been a concern going forward, but the state didn't find any other decorative fountains or hot tubs or other potential sources identified. So then fast forward to what they did beyond that, they looked for more information from the cases and they interviewed those cases to understand where they'd been. All of those cases were geographically clustered within about a 1.6 square mile area. This happens to be a map that the state health department put out on their website. And they said, people with Legionnaire's disease are in this box. And then they also said, we attribute the problem to the drinking water system based upon limited sampling that had not confirmed Legionella in the distribution system, but in buildings served by the distribution system. So as you might imagine, not a great way to message that. And it led to the water system having to engage some others with what was going on with that. So after that, we were called in by really the folks at Grand Rapids with some recommendations from EPA and CDC. You can tell that from the press release in July of 23 through the next press release that came in February of 24, the total number of cases had grown. They had been working with identifying a cooling tower. They finally talked with the water utility in October. It wasn't until then that the water utility even had any sense of what might be going on. They said, we're going to come and test some of the places in the water system in some of the buildings. They came and did testing in December, and they then reported results of those in January. All the while, every month, with the exception of November, there was 1 or 2 additional cases reported. And so it wasn't until January and then February that the water utility really started to understand that they had a role to play in understanding what was going on and what they would need to address. Now, they were not out of compliance. They were meeting every compliance expectation for them, which is why I think everybody on this call should understand public health protection isn't always specifically regulated by the Safe Drinking Water Act, and state health departments don't always operate in a way that gets to the crux of the health concern when it isn't within the purview of what's regulated. So it takes some next steps. So we got involved in February, end of February. I got a phone call and said, there's a Legionnaire's disease outbreak in Grand Rapids, Minnesota. I quickly went and mapped out, where is Grand Rapids, Minnesota? Didn't even know there was one. And then we became a part of helping them move forward, which really was prompted by this press release, February 12th, that said, health officials identify the source of Legionnaire's disease outbreak in Grand Rapids. And it says, the likely case exposures have been geographically clustered, and it's all associated with bacteria from the water system. Now, the limited sampling from December just prior to that found buildings with case exposure in water storage facilities, and they looked for it in water storage facilities in the distribution system, but didn't find any Legionella there. They only found positives for Legionella in those 2 buildings. And they stated that those samples were related to each other and the Legionella bacteria from patients who had been confirmed to have Legionnaire's disease. And so they said that laboratory evidence was sufficient to support the claim that the water supply was the source of the outbreak. And so when a headline like this hits the newspapers, even in a place that isn't particularly connected to much of the news cycle, it garners a lot of attention, hit the news locally, nationally, and internationally, although I will tell you, most people in the community didn't even hear about it. Didn't know, didn't care, weren't made aware, and it was a bit of a challenge. People knew more about Grand Rapids and Legionella and Legionnaire's disease almost everywhere but in Grand Rapids. So a little bit about Grand Rapids. They are a groundwater system supplied from 5 wells, 2 different aquifers with their wells 140 to 750 feet deep. They really only had to concern themselves with the other water quality issues of manganese, ammonia, and some issues with copper corrosion because it's a pretty low pH groundwater. So their treatment plant, roughly a 1 MGD plant, you can see it in the picture on the top right there, uses aeration, adds permanganate, goes through filtration, they have partial cationic softening, and then they add fluoride. Yes, the state of Minnesota still to this day requires the addition of fluoride, but does not require the addition of chlorine disinfection because it's an undisinfected groundwater system that meets the expectations under the total coliform rule and the groundwater rule. So they have a clear well, supplies water to the 3 towers, about 81 miles of distribution system main, and they serve 3,300 service connections, including a consecutive system in La Prairie. So, happens to be the second largest population served as an undisinfected groundwater in the state of Minnesota, 12,000 people served, which is one of the biggest concerns for why we thought it was going to be a problem for Legionnaire's disease. So when we were called in, Christian, myself, and Jake went there on a balmy -5-degree day, February, March, 2 years ago, and we put them on a path to immediately address 2 prongs: investigation of sampling and disinfection planning and implementation. We needed to investigate and sample to understand what's happening in the distribution system and what's happening in the customers' buildings. Where could we find Legionella? We really only had 2 results to go off of that the University of Minnesota and EPA folks had collected before, and we knew we needed more information than that to help understand where the problem was and what could be done about it. Simultaneously looking at disinfection, we knew we needed to implement disinfection, even if it was only going to be a short-term thing, but ultimately became a permanent thing. We needed to balance how to address Legionella and also the other regulatory compliance objectives: disinfection byproducts, managing disinfectant residual requirements, and then clearly communicating to the customers about what that was going to mean. This is a community that was accustomed to having an undisinfected groundwater that they prefer, didn't want to have disinfection if they're in their water if they could avoid it. And Christian's going to get into a lot of the details beyond this, but you'll note that we immediately implemented a program to collect approximately 20 samples per week from customer buildings throughout the water system. And each building was sampled in 3 places: the entry point, meaning to represent the water coming from the water distribution system. That's the first photo on the left. You can see a water meter. That water meter is an example of indoor water meters. Minnesota, like I said, the first time we were there is 5 degrees below 0 Fahrenheit. So for freeze protection, all these things are inside, but that's the closest point for a sample location that still can represent the distribution system. Beyond that, we would take cold and hot water samples within the building plumbing to represent what's going on there. Now, we leverage the use of the IDEX Legionella approach. Glad to have had their support because it allowed us to collect and analyze and then report those sample results locally without the challenges of the logistics of getting samples shipped off and analyzed at a lab remotely. And for those of you that are in locations that are a little bit more remote, you can appreciate the fact that that can add days and in some unfortunate cases, weeks to how long it takes to get results back. The method itself can take several days, and we want to do whatever we could to shave time off of that process to help inform what we're doing and how to get those answers to tell us what to do next. At the same time, we moved forward with implementing disinfection and all the planning that went into that. We did some bench scale testing on chlorine versus chloramine. Christian will talk about the outcomes of that. We then had to plan for how to implement this at full scale, thinking about flushing, corrosion, nitrification control, and disinfectant byproducts, which that gives you a hint. We did move forward with chloramine for a few reasons, and we had to go through design and construction. As I'll say, we first got called in the end of February, first time in person there, first week of March. We started disinfection with this team June 24th of 2024. And we were literally working against the clock to implement disinfection and measures to protect the community against Legionnaire's disease as best as possible because we were concerned that this outbreak was likely unchecked and could grow exponentially and be unbelievably detrimental. So you see on the right there, chem feed systems for both sodium hypo, We had liquid ammonia. We added control systems to dose both chlorine and ammonia to trim it going out into the distribution system. We started targeting in the 2 to 3 milligram per liter total chlorine into the distribution system. We knew we needed to have some concerns for initial demand. And I'll say our experience dealing with these issues and most of the water community's experience dealing with these issues has been focused on buildings where there's a hospital, Veterans Affairs facilities, for example, or there's a courthouse, or there's a hotel where a Legionnaire disease outbreak and occurrence of Legionella are problematic. In those cases, the common approach is do what you can to mitigate exposure first. So you turn off hot water, you turn off hot tubs, you turn off and clean decorative fountains, you stop using humidifiers, you then implement protective measures at showers, or you tell people not to shower at all. You just stop all of the exposure means for Legionnaire's disease. And you can do that in a building. You cannot do that in a community of 12,000 people. It's not possible to have everybody install a Legionella protective shower head fixture. So we were concerned about what might happen when we implement disinfection. Might this cause an increase in Legionella into the distribution system, into points where customers could be exposed? And I'll show a little bit more of that, and Christian will show even more of the detailed data in the subsequent talk. So all this to say, we moved very quickly to implement this. Kudos to the design and construction and operations staff to pull this off. This was legitimately light speed to address this public health concern. Now, just a couple of pictures about how we selected chloramine over free chlorine, and as I said, Christian will talk more about this, but put simply, we chose chloramine because it was a stable disinfectant residual and it would last longer in the distribution system and into buildings. And we knew that we would have lower DBP formation potential. And because this was an unfiltered or a undisinfected groundwater previously with some measurable TOC, if we had used free chlorine, we would have had to improve upon the precursor removal to meet DBP requirements. And we just simply couldn't do that fast enough. We also knew that chloramines would have a less noticeable chlorine taste and odor as compared to free chlorine, and that would be better for customer acceptance. Photos of all the work that we did in our lab here that's just outside of our offices, and grateful to have been able to do that so quickly to answer those questions. Here's a quick timeline. Again, we had our first community workshop the 1st of March. We did bench testing just a couple of weeks later. In 2 to 3 months after that, we addressed corrosion control, flushing, and nitrification control plans. We started Legionella and Haemophila weekly sampling the first week of April, and that's kudos to IDEX being able to get the equipment and supplies there, and the utility staff, and frankly, Christian, for getting everybody up and started to move quickly. We also held some expert panels beginning and end of April. EPA, CDC, academic, and other institutional researchers and other water utility experts to help guide us in the process. We communicated plans to the state for approval, and then got approval for implementation and communicated at a town hall beginning of June, and started it in the end of June. Like I said, pretty record pace getting that to happen. One thing that was helpful, the utility had a GIS platform that allowed us to have information pretty real time about disinfectant residual in time and space, which when we pushed go on the chem feed pumps and started applying chloramine disinfectant, leaving the water treatment plant through the clear well and out into the distribution system, we did not know how long it would take for chloramine to reach all areas of the distribution system, and then how long it would take to get from meters to the distal taps in each of those buildings. We had estimates of anywhere from a week to a month, could even take longer. There's other places in Minnesota that had implemented free chlorine after having never been disinfected before, where it had taken many months to get detectable chlorine residuals throughout the water system and in buildings. We didn't know it was going to be the case in Grand Rapids. Now, I am so grateful to say it all happened in about a week, which is incredible that the chloramine disinfectant residual was both able to be applied effectively and consistently, and the flushing efforts to draw that water throughout the system and the encouragement of water users in their buildings to use water achieve those objectives very quickly. And here's where I want to show you what happened. We had weeks of Legionella pneumophila monitoring starting in April, and we were averaging 20 to 50% of those samples being positive for Legionella pneumophila. And once we started chloramination, and you'll see those total chlorine average weekly results on the top right there, averaging between 1 and 2 milligrams per liter, those percent positive Legionella pneumophila results dropped to 0 within a week or two. And that's not just in the distribution system, because we never found Legionella pneumophila in the distribution system. We only found it in buildings. It happened in buildings in both hot and cold water systems, which is incredible. So here's a quick little example. This is a time series graph, same type of thing, but 2 different buildings. And you'll note the Legionella counts on the y-axis are on a log scale, directed in a most probable number per 100 milliliter result. We used a threshold of 10 MPN per 100 as a level of concern, and above 100 and certainly above 1,000, it really is concerning. So before we started chloramination, those building hot and in some cases cold water system results were legitimately concerning. Now the 0 results, which are reported down there at the very bottom, at the 0.1 just for 0 for purposes of graphical representation, are places where we had results coming into the building where we never saw anything in the distribution system of the water system. But this was to demonstrate how effective chloramine disinfectant was immediately addressing the Legionella occurrence in those buildings. So this is the both happy and kind of sad outcome of the result. So, I showed you the results up through February. We had another 1 case reported in March, and in April of 2024, we had many cases reported in March or in May and June, ultimately hitting 34 cases. And I'm really sad to report that 2 deaths have been reported attributed to the cases in June of 2024. And you'll see that there was that start of an exponential rise in May and June. And we knew that increasing water temperatures are commonly a part of that. So we're sad about those cases and those that were lost, but we're grateful that we were able to pull off chloramination very quickly. And since that time, there have been 0 reported cases of Legionnaire's disease in Grand Rapids, Minnesota. And they have done a continued good job about how to address that. I'll note that the state of Minnesota Department of Health website did finally update here just last month to recognize the 34 total cases and the unfortunate outcome of 2 people having died as a result of the illness. That means 2 deaths out of 34, so 1 per 17. Generally, there's 1 death for every 10 or 12 cases, which is why we were hurrying so fast to get implemented, because we knew that we were racing against the clock and potentially having more people detrimentally impacted. So I'll leave these takeaway message on screen. Really important to communicate. Prioritize what's important for your public health protection. Let your customers know what it takes to do these things. And then I'll tell you, maintain disinfectant residuals everywhere all the time. While this was an undisinfected groundwater, there are chloraminated and chlorinated water systems that have parts of their systems that don't ever have effective disinfection. And it isn't always caught by the regulatory sampling. I'll last say, a great committed team can accomplish a lot quickly, and I'm grateful to have been a part of that, and glad to pass it off to Christian so she can share the next parts of the story. And Carly, if you want to have questions now or after Christian, glad to follow your lead. I think you're on mute.
Apologize, I was on mute. Thank you, Chad, for a great presentation. I did want to just see if there were any questions right now for Chad before we move on. You can type your questions in the chat box, and I can. I will ask you one question right now, and then if anyone thinks of a question, put it in the chat, and we can come back to Chad at the end. But in your opinion, should all groundwater systems be disinfected?
I love that question. Short version of that answer is yes. I am a huge proponent of disinfection, and as a part of EPA's current process to revise the microbial and disinfection byproduct rule package, some on the list here I know have had involvement in some of those issues over the last several years. There's an expectation that EPA is going to implement a minimum numeric disinfectant residual requirement, but that's just going to apply for surface water systems. I'm an advocate that groundwater systems should be disinfected, with one caveat. If you are a small groundwater system that is under pressure in all locations, meaning you don't have anything open to the atmosphere. Grand Rapids had an aerator, had open to the atmosphere gravity filters, had open to the atmosphere elevated storage tanks. If you have any of those and you're a groundwater system, I think they should be disinfected.
Thank you. All right, I don't see any other questions yet, so let's move on to Christian's presentation, and then at the end of her presentation, we can come back if there are any questions.
Thanks,
All right,
Carly.
thank you so much, Chad. Christian, feel free to start as soon as you're ready. All right, thank you.
Can you all see my screen in full screen? Yeah. Great. Okay. Thank you again, Chad, for that great introduction to the Grand Rapids project. Today in my presentation, I'm going to give you a little bit more specific details about what was specifically done in regards to bench testing and monitoring in the distribution system after the outbreak had occurred. Okay, so just as a recap, there was a pretty significant Legionnaire's disease outbreak that was identified in Grand Rapids, Minnesota last year in 2024. And our key goal was really to develop a plan of action to implement disinfection, because disinfection of the system was the best path forward to help reduce Legionella pneumophila growth in the system. So as part of that plan of action, there were two main objectives that we worked on. So specifically, first, we worked on bench testing to inform which disinfectant would be best for this particular system. So we analyzed free chlorine and chloramine to determine which one would have a more stable residual in their system, depending on their specific water chemistry. And then we also had them set up a water quality monitoring plan in their distribution system and in their buildings so that they could have a better idea about where Legionella pneumophila would be specifically growing in their system. Okay, so just to give you some more details about the specific approach, first we conducted bench testing, and this was really used to help inform the selection of the disinfectant moving forward. So with that, we looked at the specific residual decay kinetics as well as the DBP formation potential. And we had the utility set up their own water quality monitoring plan. And with that, we had them monitor for Legionella pneumophila, as well as ATP and temperature and a couple of other parameters in their system, and then also in buildings. So to provide more details about the specifics for the bench testing, both free chlorine and monochloramine were tested at doses ranging from 1 milligram per liter all the way up to 4 milligrams per liter. And with that testing, we looked at the decay kinetics to see how stable the residual would be, as well as looking at the TTHM formation and the HA5 formation over a period of 7 days. So moving into some of those results now, you can see here, this plot is for the free chlorine decay, and our goal was really to determine which free chlorine dose would result in a 0.5 milligram per liter residual at the end of 5 days. So if you look at this plot here, you can see that with the doses that were above 2.5 milligrams per liter, that would be the dose required to still have a 0.5 milligram per liter residual at the end of the 5-day time frame. And then we also evaluated monochloramine decay over the same 7-day time frame. And we had that same goal to determine which dose would result in a 0.5 milligram per liter disinfectant residual at the end of 5 days. And you can see that compared to the free chlorine results, that the monochloramine was much more stable, and that for all of the doses that tested, 1 milligram per liter and up, that resulted in a 0.5 milligram per liter residual at the end of 5 days. So just comparing those two head to head, comparing the free chlorine and the monochloramine, you can already see here that the monochloramine emerges as a clear winner because it was more stable over time, which is really what the system needed. They needed a more stable disinfectant to help eliminate some of their Legionella and Pneumophila concerns. And having a more stable residual also helped. I'll show in a couple of slides that it helped reduce Legionella and Pneumophila growth in the system. And this plot here on the right, you can see that the total chlorine matches up really well with the monochloramine results. And this is what we want to see. This implies that there was not a large formation of other types of chloramine, including di and trichloramines. Okay, so moving into the DBP formation, you can see some very stark differences between these two plots here. So the plot on the left is for free chlorine, and the plot on the right is for monochloramine. So you can, and this red dashed line represents the MCL for TTHMs, which is 80 micrograms per liter. You can see pretty clearly that with the free chlorine, that there were some potential MCL exceedances for the doses of 2, 3, and 4 at the time frame days 5 and 7. Whereas with the monochloramine, you can see that for each of the doses tested here, a dose of 2, 3, and 4, that the TTHM formation never even gets close to that MCL. And in addition to that, the TTHMs were fairly low, often ranging between 10 and 20 micrograms per liter for the monochloramine. Also wanted to look at the HAA formation. You can see pretty similar results here again too. On the left, we have the free chlorine, and on the right, we have the monochloramine. And you can see that for the free chlorine doses of 3 and 4, that there will potentially be some MCL exceedances for HAAs as well. And then for monochloramine, you can see very clearly that there would not, that the concentrations were very far below the MCL, typically between 10 to 20 micrograms per liter. So also very low DBP formation for monochloramine for both of the DBPs that were tested here. Okay, so just to summarize some of the bench testing that was conducted, we wanted to determine which concentrations would result in a 0.5 milligram per liter residual at the end of 5 days. And we found that free chlorine would require an initial dose of 2.5 milligrams per liter to maintain that residual at the end of 5 days, whereas monochloramine maintained that residual at 5 days for each of the doses that were tested. And then just to highlight some of those DBP formation results, we saw that the free chlorine tests typically resulted in some MCL exceedances for both TTHMs and the HAAs. Whereas with the monochloramine, it never exceeded any of the TTHM or HAA MCLs for any of the doses that were tested. So again, here, monochloramine really emerges as the winner too, because it did not result in any DBP MCL exceedances. Okay, great. So let's move into talking a bit about the monitoring that occurred in the distribution system. So the utility monitored some parameters that would be really important for understanding Legionella growth in the distribution system. So they looked at the water temperature and the pH, because we know that temperature plays a very big role in predicting Legionella growth in the distribution system and in buildings. They also analyzed the ATP to generally understand where there may be areas in buildings that may have higher amounts of microbial growth. And then the utility utilized Legionella method to analyze the Legionella pneumophila in the distribution system, whereas the Minnesota Department of Health also wanted to run the samples in tandem with the utility so that they could determine if there were any differences between the Legionella method and the culture method. And so I'll go into a little bit more detail about that in a couple of slides, but they also monitored the chlorine residual after disinfection began. And they also did select their sample locations based off of their previous total coliform monitoring sites, as well as they chose some buildings that would potentially have some higher risk populations. So some of the sample locations that they picked were nursing homes or other buildings that may house other at-risk people who are potentially more prone to developing Legionnaire's disease. So in case you're not familiar with these two monitoring protocols, I just wanted to give a brief overview of the standard BCYE culture method that's often used by labs and also the Legionella assay. So just to compare, the typical culture method typically requires more prep time, often 10 to 40 minutes per sample, due to additional steps that are required to concentrate the Legionella. So that can include things like filtration or heat treatment, whereas the Legionella assay typically only takes about 5 minutes per pair, which is very nice if you're running a lot of different samples like the utility was here. And also the traditional culture method typically requires additional verification steps or additional culture methods to confirm genus, species, and different serogroups. Whereas Legionella is really great because there's no need for that additional verification step. It's very selective against non-pneumophilous species, and it detects the specific serogroups, especially serogroup 1, which is the one serogroup of Legionella pneumophila that is most relevant for Legionnaire's disease. And then the incubation time for the standard method is typically 7 to 10 days, plus additional time for those verification steps that are required, whereas Legionella typically only takes about 7 days. And in addition to that, it can also be more sensitive at lower concentrations. I'll go into more detail about that in a couple of slides, but Legionella often detected Legionella at lower concentrations than the standard culture method was able to. Okay, so moving now into some of the chlorine testing and results. As Chad mentioned, chloramination began on June 24th. And you can see here these different colors. The blue represents the building cold water, and the red represents the building hot water. You can see that the disinfectant residual was fairly stable over time after disinfection began. And on average, the total chlorine concentration in buildings was 1.9 milligrams per liter, and in the hot water samples, it was 1.1 milligram per liter. So pretty consistent, stable residual after disinfection began. We also wanted to look at the DBP formation in the buildings after disinfection began. So these samples were collected in buildings in September, which was just a couple of months after disinfection began. And you can see from the TTHMs that the concentrations were fairly low. They were typically around 20 to 30 micrograms per liter. And for the HAAs, the concentrations were typically 10 to 20, which is really great to see because those were that's the same range of concentrations that we saw in our lab testing, which was performed in clean amber glass bottles. So to see the same rate of DBP formation out in the distribution system is really great to see that our bench test matched up really well with what was observed out in the system. Okay, so moving forward with the Legionella pneumophila results, this is broken up into the distribution system samples, the building cold water in the middle, and then the building hot water on the right. And you can see that Legionella was never detected in the distribution system. However, it was typically detected in building cold water samples at concentrations ranging anywhere from non-detect and greater than 100 mpm at times. And it was really important for the utility to monitor Legionella pneumophila before disinfection began so that they could inform their customers and give them specific feedback about what they can be doing to help reduce those Legionella pneumophila concentrations in their buildings prior to disinfection beginning. So like Chad mentioned, we were working against the clock trying to get disinfection implemented as quickly as we could, but we were also, the utility was also working to collect these samples so that they could also inform the community about steps they could be taking in the interim before disinfection began. And then, so this green dashed line here also represents the date that chloramination began. And you can see here that there were very few detections of Legionella pneumophila after disinfection began. So that was also really great to see that disinfection was doing exactly what we wanted it to do. We were starting to see less Legionella detections in the buildings after disinfection began. Okay, so I also, going back to that comparison again of the Legionella method and the culture method, lots of previous studies, I want to say I found at least 4 or 5 different studies have looked at this before. So it's pretty well established that Legionella methods match up really well with culture methods. You can see here, the blue represents the Legionella results. The pink color represents Legionella pneumophila non-serogroup 1. And the green represents Legionella pneumophila serogroup 1. So you can see that oftentimes, if you add the pink and the green together, that the results were very similar between the Legionella method and the standard culture method. Or in other situations here, you can see, like for this June 10th sample week, for example, that the Legionella often predicted higher rates or had higher rates of positive detections compared to the culture method. And this is likely due to the fact that Legionella could detect Legionella at those lower concentrations of 1 to 10 mpn, whereas the culture method did not detect it at those lower concentrations. Okay, so we also had the utility running ATP samples during this time. The idea initially was that that the ATP results could potentially serve as a proxy for microbial growth in the system, indicating certain areas where there might be higher amounts of microbial growth in certain buildings or in the distribution system. And so we also looked at a correlation analysis to determine if there was a specific correlation between the Legionella and the ATP, and we found there was not a correlation. But this was just interesting to see here too, that the ATP concentrations dropped off pretty drastically after disinfection began. Okay, so just to summarize some of the specific results from the study, we found that Legionella pneumophila was only detected in buildings and it was never detected in the distribution system. And we found that those Legionella pneumophila detections began to drop off very dramatically after disinfection began. So that was really great to see. And some of the key actions that were taken in this project were to utilize bench testing to pick the best disinfectant for this project that would result in a very stable residual, as well as not have a high rate of DBP formation. And another key action in this project was to monitor Legionella pneumophila in the buildings, both before and after disinfection, to help keep customers safe and informed about their water quality. And finally, implementing disinfection was a huge step in this project to help eliminate or reduce Legionella pneumophila in the buildings and also protect the community from Legionella. So some of the conclusions from this project, chloramine was the more stable disinfectant option and resulted in lower DBP formation, which was great to examine that beforehand so that the community would also be protected from any potential spikes in DBP formation. And it was great to see that the DBP formation potential assay that we performed in the lab matched up really well with what was observed with the DBP levels in the distribution system. And we are just very grateful that there have been no more cases in the system almost 1 year after disinfection has begun. So it's just great to see how this project has progressed over time. And we have had a lot of great support throughout this project from the county health department and the state health department, as well as all these different consulting teams and this expert panel that included members from the CDC and the EPA and a couple of other universities. So with that, I think we have time for some more questions.
Great. Thank you so much, Christian. So we do have a question that came through the chat, so I'll start with that one. Regarding disinfection dosing, did you start out with a higher dose initially and then dial back, or was it a consistent dose? And were there any other practices employed to really drop those positive detects?
Guess I'll jump in and answer. The strategy was to initially target a roughly 2.5 to 3 milligram per liter total chlorine dose, frankly, with an intent and expectation to get meaningful disinfectant residual with measurable results throughout the water distribution system and into and throughout buildings, both cold and even more so hot water systems. Addressing Legionella bacteria is a multifaceted approach. It starts with keeping the hot water hot and the cold water cold, and the cold water needs to have a measurable disinfectant residual. And anything that's in between in this temperate range that's ideal for the growth of Legionella bacteria, disinfectant residual is really important. So we started higher. It has been backed off since then. They're operating more in the 1 to 2 milligram per liter range now. And we didn't know what we were going to experience. We were unsure if the disinfectant applied would encounter significant demand, whether it be biological or inorganic demand in the distribution system. We also thought there might be a need for really substantial flushing to get, whether it be sediment or other biofilm, out of the distribution system. And none of that was needed. And we didn't find any evidence of those concerns when this was implemented. So again, we're really grateful for that. I don't think I would count on that being the case in most other distribution systems, though.
Thank you. And I guess just one more question, Christian, since you showed a lot about the monitoring and the analysis process, I'm curious if you were making recommendations to a utility that wanted to start monitoring for Legionella, would you recommend the standard plate culture method that you described, or the Legionella that you also showed results for?
Yes, after having run both in a lab setting, I would definitely recommend Legionella. It's just much more user-friendly and it takes less time. So it's a great method, and multiple papers have shown that the results match up really well. So yeah, I would pick Legionella.
Great, thank you. I think that's probably all that we have time for. So I am just going to share. Just a reminder that we do have a drawing for the M7 manual, and that will be, I believe, we'll be randomly selecting one of the participants that was part of the webinar, so attended the full webinar, and an email will be sent to you following the webinar. And also, I did want to let everyone know that TCH credits or certificate will be awarded for today's webinar. And also an email will be sent to you following the webinar with a TCH certificate.
Yeah, and so let's go ahead and have Christian choose a number from 1 to 33, and that'll help decide our winner of the drawing.
Okay, how about 9?
9. Okay, so that means that Sean Dubois is our winner of our M7 manual. Congratulations, Sean. And I will be in contact with you to get your mailing address.
Great.
Thank you, everybody, for attending today.
Some great reading in your future there. It's going to be terrific.
Yeah.
Thanks all for joining us.
Yeah.
Appreciate you listening in and hopefully sharing what we learned with as many others so we can prevent these impacts from happening elsewhere.
Yeah.
Great.
Thank you all. Thanks for all who attended. And thank you so much, Chad and Christian, for presenting all this information.
Yes.
Great.
Great.
Bye-bye.
Take care,
Thanks,
everybody.
all.